Hi, everybody. I am getting ready to go live talking about nutrition and dietary guidelines in traditional Chinese medicine. So I'm just going to, I think it's time. Okay. Hi, everybody. All right. So here we go. All right, so it's 12 o'clock, and I am going to do a Facebook Live presentation today on dietary and nutritional guidelines in traditional Chinese medicine. So, welcome. I'm Karen Siegel-Propus, and I am talking today as a dietitian as well as an acupuncturist. So, it has been well documented going back to 400 BC when Hippocrates stated, "Let food be thy medicine and medicine be thy food," which of course emphasized the importance of nutrition to prevent or cure disease. So it's well documented that good nutrition is paramount for good health. As a registered dietitian trained in dietetics from a Western medicine perspective, I have years of experience and understand the role that nutrition can play in health prevention as well as in managing disease, especially diseases that are influenced by diet and lifestyle, like diabetes, heart disease, high blood pressure, even to a certain extent, kidney disease. So, from a Western nutrition perspective, we're all pretty well versed in the role of protein, fat, and carbohydrate. We follow diets based on modifying some level of protein, fat, and carbohydrate. We take vitamin, mineral supplements, just kind of as an insurance policy to keep us healthy. We may supplement for other reasons, for calcium and iron, but that is a very, very much a Western medicine perspective, and that's what we know. What most people don't understand, and as a registered acupuncturist as well, what I want to talk to today is that Chinese medicine also views nutrition as an important component to preventing disease and keeping you healthy, and then also in healing certain diseases. So just imagine if you can get the best of both and combine Western and Chinese nutrition therapy, how much better off you can be in promoting your own health and or helping you heal from especially food-related problems. Food therapy in Chinese medicine aims to maintain balanced nutrition through diet, just like in Western nutrition therapy, with the hopes to maintain health, prevent disease, alleviate illness or prevent illness, and maybe even slow aging. But in Chinese medicine, the goal of food therapy is a little bit different. Its goal is to balance the yin and yang while at the same time considering a whole person's constitutional health. Our constitutional health comes from a lot of bases, what we're born with, our hereditary, what our parents gave us, and then what we get through our diet and the air we breathe. A good diet supports all the organs of the body, which in Chinese medicine includes the kidney, the heart, the liver, the spleen and stomach, and the lung. With each organ system, there are different food guidelines that support their function in general and also support their function during different seasons. Now, I did touch on this 2 weeks ago when I talked about liver being the organ of spring and the foods that we eat to support our liver health. Quite honestly, this topic is really complicated and could be a whole course just in food therapy and Chinese medicine or an extended workshop. But to get you started on thinking about food as medicine, I'll give a brief description of the role and the purpose of the dietary recommendations in traditional Chinese medicine. I'm just going to say TCM instead of traditional Chinese medicine going forth. And the first place to start in learning about food in TCM is to understand a little bit about yin and yang and qi. The goal of Chinese medicine, the goal of Chinese food therapy is to harmonize yin and yang so they are in balance. TCM believes that a state of health reflects the balance of yin and yang, while a disease state implies an imbalance of yin and yang. I'll explain what yin and yang are in just a few minutes. TCM also focuses on the flow of qi. Qi is a Chinese word, which I think most people are pretty familiar with the words qi and the words yin and yang. Most Americans call it yang, but the proper way to pronounce it is yang. Qi is a Chinese word meaning life force or your vital energy. And qi flows like a stream through the meridians or channels in your body and connects all of your organs. The basis of TCM is to promote the balance and flow of qi energy through the body. Without qi, we basically cease to exist. Qi is the life force, the energy that keeps the blood pumping, the liver detoxifying, the blood flowing. And we need to have a smooth and even flow of qi to support the qi or the energy of our yin and yang. So what is yin and yang, and why is balancing it so important? The theory of yin and yang is fundamental to the practice of TCM in terms of understanding, diagnosing, and treating health issues. So at the most basic and at the deepest level, TCM seeks to balance yin and yang in each person. So yin, I'm going to just pick this up so you can see the yin and yang image, which most people are very familiar with. Can you see it, the yin and yang image? Okay. The yin is our cooling, moisturizing, quiet, contemplative, reflective energy. We go in and it's just very quiet, contemplative energy, where yang energy is warm and uprising and energetic and drawing. So in a typically poetic way, the Chinese characters for yin and yang reveal something about their respective qualities. For example, the character for yin can represent the shady side of the hill, while the one for yang indicates the sunny side of a hill. So I'm going to give you just a few yin-yang pairs so you can really get an example or get an idea of the difference. Yin and yang are interconnected, but they're also separate, and one cannot exist without the other. And you'll understand that point when I explain these pairs. So you have heaven and earth. Heaven is up, it's yang. The earth is down and deep, it's yin. The sun and the moon. The sun is hot, it rises up. That's more yang, warming energy. The yin is the moon. You have light and dark. The light is yang. The yin is the light is yang. Darkness is yin. Fire and water. You get the idea. Yin and yang pairs in the body are exterior of our body is yang. The interior is yin. The back of our body is yang. The front is yin. The head is yang. Okay, the body is yin. Above the waist is yang. Below the waist is yin. So you get the idea that they exist. They cannot exist without each other, but they're also separate. So what happens if yin and yang are not in balance? What does it mean if you don't have the qi or the vital strength or the energy to support your yin and yang? As I mentioned earlier, this topic has a lot of components, and it can go on and go on many different levels and depths. But generally speaking, if your yin, which is your cooling energy, is weak, or we say deficient, it means that the yang or the warming energy is too strong and it's overpowering the cooling qualities of your body. If your yin is your cooling energy, it's being controlled by too much heat, your yang energy, what are you going to experience? You're going to experience more heat in your body. On the flip side, if your yang, remember your yang is your warming energy, is weak or deficient, it means that the yin or the cool energy is overpowering the warm energy and you feel cold a lot. So our yang qi energy warms and stimulates the body, and it gives us strength and vigor. If we lack that yang qi that makes us move and go up, our body will show signs of coldness, weakness, and fatigue. The yin qi energy, the cooling qi energy, functions to moisten and cool the body and helps to quiet the mind and allow it to rest. If the yin is weak or deficient, the body will lose, because it's weaker, it's not functioning as well, the body will lose its ability to maintain these vital functions, and it'll get too hot. So now I'm going to describe what some of the symptoms of yin deficiency and yang deficiency are, and what are some typical body types of yin and yang. I'm going to briefly talk on the body type because I'm going to do a whole 15-minute segment next Monday on our body types and what we can learn from how our typical body types are. So to give you some backstory a little bit in terms of yin and yang and what we look for, whenever we meet a patient, we do a thorough assessment of emotional and physical symptoms to determine where there's an imbalance. And based on this assessment, we determine and create a treatment plan. So I'm going to give you some symptoms of people who are yin deficient. So if you're yin deficient, think about it. I want you to organize your thoughts. If you're yin deficient, that means your cooling energy is weak, so you feel more yang, okay? A good example is we all have yin and yang. Can you see my hands? We all have yin and yang. And if we become yin deficient, that means our cooling energy gets weakened. We have a relative excess of yang, too much heat. The goal in treatment is not to reduce the heat. The goal in treatment is to stimulate and strengthen your yin energy to put you back in balance, okay? The same thing goes for yang. We want a balance of yin and yang. If we become yang deficient, that means our warming energy is weak, then we have too much, a relative excess of cool or cold energy. So the goal in treatment is not to increase the yang, is not to decrease the cold energy, but to tonify and strengthen your yang energy to put you back in balance. So yang, symptoms of yang, too much heat or yin deficiency. Most people who tend to be yang are sturdy and strong. They tend to be susceptible to hot temperatures. They're more uncomfortable in hot temperatures. Oftentimes have a dry mouth. Why? Because if you have more heat, it consumes the fluids. Tend to be more reddish in complexion. That makes sense. More heat in the body rising up. Also tends to be more easily irritated. Insomnia can be a problem. Quite often the urine is dark or the stools are hard. If you look at a yin deficient person, they might have a red tongue and they might have a yellowish coating. And most people who are hot tend to prefer cold meals, cold food and beverages. So that makes sense, right? That if you tend to be yang deficient, in other words, your warming energy is low or weak, you tend to feel colder. So more yin people tend to be more frail, thinner bodies. They're usually cold averse. They get cold really easily. Their complexion could be pale or white. Usually will have clear, copious urine, a tendency towards soft stools or diarrhea. Tend to have a puffier tongue. So if you look at the tongue, it can be puffy and swollen. Prefer to go with hot meals, hot food and drinks. And as I said, tend to be cold averse. So these are just two yin and yang examples. But in addition to yin and yang, I'm not going to go into great details, that some people also tend to be more phlegm or damp. That means they carry more water weight within them and more bloating. Or some people tend to be dry. So dry people tend to be thin, a difficulty putting on weight, dry eyes and throat. Now a neutral person, basically, which is what we're looking for, appears to be healthy with nice skin tone and color. Don't have very many of the complaints I just mentioned. They tend to have a pretty good appetite and sleep patterns. Don't feel too hot or don't feel too cold. Normal urine and stools, and kind of generally feeling good and are healthy. So it's important to know that sometimes, and the reason I mention those who tend to be damp or dry, we're not, you know, we're not simple unilateral people. Humanity is, we tend to be fixed. We're not fixed, we're complicated. So most people have a mixed physical constitution. So you could be some yin deficient and maybe a little bit damp at the same time, or dry. I'm sorry, yin deficient or dry. So it's important to know that it's just not cut and dry, but for the purpose of today, I'm trying to keep it simple. So someone can be cold and dry or damp and hot. And because of this, diets have to be individualized depending on someone's exact body type and what we assess during our evaluation of a patient. So, and it's also good to know is that Chinese medicine really is not cookie cutter medicine. One diet, one herb does not treat all symptoms. So now we have a better understanding of qi and yin and yang energy and the physical and emotional symptoms that arise when we're out of balance. So where does diet come into play in restoring this balance? You're hearing the word balance a lot, and it's by design. The basis of traditional Chinese medicine is all about balance and gently moving the body to a place it naturally knows how to be, but due to life, the stressors, eating, exercise, lifestyle irregularities, the body becomes out of sync, or I say gets out of whack, gets out of sync with its ability to recover its balance. Oftentimes we can get out of sync and then we just get right back in balance, but sometimes we just don't bounce back. And as we all know, too much of anything will create an imbalance. Extremes of eating, drinking, stress, even too much exercise can create an imbalance. And when we're out of balance, we feel out of sorts. It's for good reason, because extreme behaviors have nothing to do with moderation and balance. Okay, so now we've discussed yin and yang and qi and balance. So now I'm going to, if you have identified yourself being more yin deficient, meaning you have more heat, or yang deficient, meaning you have more cold, I'm going to give you some food examples of what you can start incorporating. You don't want to incorporate all of it all the time, because then it's too much. It's all about slowly incorporating to bring a balance to your diet. So if you have yin deficiency, which meaning you tend to feel more heat, we're going to choose foods that expel heat with foods that have cooling energy, or herbs that have cooling energy. So some of these foods that tend to be more cooling are dairy products, such as eggs, cheese, and milk, beans, such as kidney bean, black bean, and mung bean, and bean products like tofu. And some vegetables that tend to help with that are potatoes, squash, sweet potatoes, sprouts, and string beans. So these foods have more cool energy and help expel heat from the body. Now, if you tend to have a yin deficiency and you tend to be hot, this is what you want to avoid. So now I told you the foods that you want to include. Now you want to reduce the frequency of these foods. Stimulating foods and beverages that have a lot of sugar, alcohol, and caffeine. You want to reduce your intake of warm and pungent foods such as curries and chilies, or ginger. Why? Because they tend to have more warm energy. If you're already too warm, they'll create more heat in your body. That's the opposite of what you really want to do. You also want to avoid eating too much of the yin foods that I told you, which are good for you, because again, too much is not good. And if you have too much of only yin foods, it could block the digestive system if eaten in excess. So remember, it's all about balance. And a good way to eat is to eat smaller meals more often. Now, yang foods, if you're yang deficient, meaning that you are colder, these are foods that can help strengthen your yang energy, your warming, vibrant energy. So grains and seeds, such as oats and sweet glutinous rice, quinoa, Sunflower seeds, walnuts are good grains and seeds to incorporate. You can put sunflower seeds and walnuts in your salads. I use that a lot. I make oatmeal. I last week did a cooking demonstration utilizing oatmeal. You can go back and watch that. Vegetables that are warming are parsnip, turnip, kale, onion, and leek. Interesting, these are the ones that are also most abundant in wintertime. So it makes sense. In winter, it's colder, so we want to eat foods that are going to warm us. Warming teas such as chai and ginger tea and jasmine tea are good for you if you tend to be cold. So when you're cold, the Chinese medical diet therapy suggests to treat cold with hot herbs or foods that have a warming energy. So some foods, additional foods that have warming energy are cinnamon, ginger, and fennel. You can add those to soups, to dispel some cold. So if you tend to be cold, you want to avoid this. And this is really very different than Western medicine, because everybody in Western, from a Western medicine perspective, salads are so good for you, and smoothies, and they drink them all times of the year. And I'm always so surprised when I see a patient who tends to be yang deficient and thin and very worried about their weight and tired and complaining of, a stomach upset, and they're drinking ice smoothies and, all winter, and they're eating a lot of raw salads. And the first thing that I say is, whoa, you got to cut all that cold stuff out, because you're already too cold. And it actually goes against the constitution of where your body's at right now. So if you're too cold and you're having these symptoms, you don't want to add cold upon cold. It's too much of a shock to the system. The digestive system is already weakened because of the yang deficiency. There's not enough body fire to promote digestion, and so the food tends to go right through, tend to have looser stools. So the first thing you do is you cut out anything raw or cold. Okay, so cooked vegetables as opposed to raw salads. And instead of smoothies, to have warm tea. Okay, have something that's more room temperature warm, and switch to cooked or lightly steamed foods and drinks. It makes sense. If you're cold, don't put cold in. If you're hot, don't add cold. It's kind of counterintuitive to not do that. But a lot of people are so focused from that Western medicine perspective that salads are good for you and smoothies are good for you, that it's actually doing more harm than good. It's not making you healthier. So these are obviously just a few examples of foods that you can start incorporating to balance your yin and yang. We have food lists at our clinic that we provide as guidelines once we determine your imbalances. But just in these past few minutes, you might have already identified some issues that you feel relate to you based on the physical and emotional symptoms I described. And you might have kind of identified that maybe you want maybe a little bit of both, but more of one than the other. Remember, it's important to note that no one diet is good for everybody. It's not cookie cutter medicine. That's the beauty of Chinese medicine. It's so individualized. So the general eating guidelines are very similar to Western eating guidelines. Is following our eat in a calm and relaxed setting. Try not to rush your meal. I have a problem with that. I tend to eat quickly. Avoid confrontation during meals, and try to be mindful of eating and what you're eating and how it's tasting, because it'll allow you to chew better and to be more mindful, to chew thoroughly. If you eat and you watch TV, or you're reading, you're checking your email or your Facebook while you're eating, you're really not eating in a mindful way. Also, a lot of people have trouble sleeping. I usually ask, how far before going to bed have you eaten? So if you go to bed on a full stomach, you're not going to sleep as well than if you make sure you have at least 2 or 3 hours from the time that you eat, from the time that you go to bed. And also, if you have problems with reflux, you really don't want to eat before you go to bed. And of course, try to eat moderately and regularly. Avoid fasting for extended periods of time, or binging and overeating. That really weakens the whole digestive system. Without a strong digestive system, you're not going to have a healthy body. So the question remains, is really diet therapy enough to balance me out? And the answer to that is, well, it depends. It depends on how chronic the condition is or how severe. Usually, diet and nutrition is enough for just basic general health. You tend to be generally healthy, but it's not in and of itself to correct all imbalances. It's just one part of a bigger picture of creating balance. There's no one thing that's magical, but it's a combination of what you do to give yourself an opportunity to have good health. So good nutrition and eating, along with life attitudes, lifestyle habits, and dealing with emotional stress. And emotional stress can definitely derail our exercise and our eating patterns, especially if you tend to look to food or lose your appetite when you're stressed. It can definitely create an imbalance. But all of those are parts of what we need to look at in order to try and create good health for ourselves and prevent disease. Nutritional therapy can, however, be an excellent supplemental therapy in conjunction with other Chinese medicine modalities like acupuncture and herbs. It's really a great way because the acupuncture is really good to help regulate the flow of qi in your body and to create that smooth flow of energy. And food and herbs can really help balance your yin and your yang. In addition to TCM practices that I've just mentioned, dealing with emotional issues is really an important part of good health. And if you find that you keep getting into a vicious cycle of anxiety and you're not taking a look at what's really going on with you, it's going to be hard for you to be in good health. Also, getting enough sleep is really critical to good health. So don't eat too close to bedtime, and maybe doing some kind of quiet meditation before going to bed can help quiet the mind and help you get to a healthier, more balanced place with yourself. A great part of TCM's healing approach, and this is really what I love about Chinese medicine, is it really helps you step back from your life and look at where your life might actually be creating health issues for you. If you can't step back and if you keep having the same problems over and over again, it's a perfect opportunity to say, the definition of crazy is doing the same thing over and over again. If you find that you're getting to a cycle of health issues, step back. What is it in your life that might be creating a vicious cycle and preventing you to get healthy? For most people, that process happens over time, and for some, it comes at a moment of great insight. And unfortunately, that moment of great insight can often happen when you've been given a diagnosis that you're not happy with. And especially if it's a diagnosis that is diet and lifestyle related. So sometimes it's a wake-up call for us to step back, take a look at what we're doing. From the TCM perspective, what is the point of continually treating problems or symptoms that are caused by emotions, patterns of thought, belief systems, or a lifestyle that is out of balance? Truly, if you think about it, isn't it better to understand and work to change the root cause or the causes of the problem? This perspective can help you more peacefully view the world and your role in it. In terms of personal health, if you think about how you feel and when you feel really well, you might realize you don't even think of wellness at all. Everything in your life flows and moves seamlessly, kind of like everything's in harmony. Your body, mind, and emotions and spirit can adjust and readjust, in other words, bounce back to the various circumstances in your life, because life happens and life gets in the way and we get caught off guard. But how quickly can we readjust and get back into a healthy place with ourselves? Well, this is precisely the state of TCM, what TCM seeks to create, and that is of balance. So I want you to also give you an update that we are looking and discussing in our clinic about when we're going to come back and start seeing you all. And we're all so anxious to get back and get in touch with you and to get back into treating patients. So we have been discussing it at great length in our clinic. We've been getting together and meeting through Zoom and what it's going to look like and how we are going to abide by the CDC guidelines. And our clinic is going to be clean and ready and safe for you to come back and see us. And we will let you know, we'll give you a heads up, but I'm telling you now, get ready because we are looking to get back into business of being caregivers on a one-on-one basis. With that, I'll say goodbye. Have a great day. It's sunny outside. Enjoy the day. Get out and get some fresh air and take good care of yourself. All the best. Bye.